I'm so excited about our guest today. She is a medical doctor that specializes in aesthetics. Please help me to introduce MD Dr. Ford.
Hi, my name is Jonathan McLean, and I'm the founder and CEO of McLean Aesthetics.
Welcome to the dark side.
Let's go.
Hey, Dr. Ford, how are you?
I'm good. How are you doing?
Good. So let's jump right in. I'm excited to talk today. I know when I met you, I was just so impressed. So I want the audience to really see everything that we talked about, and think, no, seriously. So how did you tell us? I know there's not a residency for aesthetics. How did you even get into aesthetics?
So when I was in residency, and I'm family medicine by trade, I got a chance to meet this doctor she had a family medicine office on one side of the building and an aesthetic medical spa on the other side. And
Yeah.
I thought that was pretty interesting. And so getting a chance to do some rotations with her and see what the medical spa industry was about really helped me out. And that just kind of triggered things for me for the future.
Nice. So you started off as family medicine. What made you want to get into family medicine, or is that like the general route that many MDs follow?
Well, there's a lot of different things that you can do. I mean, of course, there's dermatology, there's surgery, plastic surgery. So you'll see other people who are in the medical spa business who are in those different fields. Then you'll also see somebody who's a one-off, like who's an endocrinologist or a rheumatologist who's also doing medical spa industry, treatments. So for me, the reason why I chose family medicine because it encompassed everything. I got a chance to take care of children as well as teenagers, as well as adults and elderly, and just getting a chance to take care of everybody, the whole gamut of people. That was a lot of fun.
Nice. I'm sure you went through a lot of different exposure, um, being in family medicine.
Oh yeah. Yeah.
So when you decided to get into aesthetics, how long did it take you to get from like, hey, I'm just gonna practice this to, hey, I'm gonna open my own med spa, I'm going to go full in?
So I actually did the traditional family medicine route for a few years. I was a family medicine doctor in private practice. I worked with the military. I also was a medical director for urgent care and did that for several years. And after working in the urgent care, I said, you know what? I want to kind of go back to something I really like. And so last year, I decided to, leave my job from being a medical director at urgent care and just did a lot of contemplation and thinking about what I wanted to do. And I met up with some nurses who do some other, who are interested in aesthetic medicine. And we all just kind of put our heads together and say, hey, why don't we do this? And so here I am in California opening up a medical spa.
Nice. That just shows a lot of determination, honestly, just to go from like something so sure, some certain to like building your own thing is it takes a lot of resilience and so amazing. Congratulations on that.
Thank you, Jonathan. Yeah, it's a learning curve, I'll tell you that, because when you're trying to get all the paperwork together and get things going and look at your codes and stuff for your building, it's a lot more to learn and you have to kind of learn it as quick as possible, like on the fly. So
For sure. Let's talk about that. What are some challenges that you faced or some adversity that you faced really opening your own med spa in that area?
finding a good place and people who are going to be a good fit. So, I would, it's one of those things where just trying to make sure that I get a good fit of where I'm going to be. And even just getting to know the lay of the land and say, okay, I want to make sure this place has ample parking, ample lighting, safety, things like that. And then making sure that things are up to code and just trying to get, this is the paperwork and just time. So it's one of those things you want to rush things, but at the same time, you can't rush it because you want to get the right fit.
Mm. That's a good point. Timing is everything, especially in this industry. Like
Oh, yeah.
there's you know, me, I do a lot of consulting with businesses also, besides the recruitment. And I've learned so much about timing, especially with the codes and things like that, to really opening a spa. So I can definitely agree with you there. What are some the things that you have to do opening a spa? Like as far as talent wise, who are the people that you have to hire and how is that process?
Well, right now it's just me,
Oh yeah.
but I do have a nurse who's interested in learning how to do laser stuff. So my specialty is
Yeah.
more laser aesthetic. And I basically have purchased 3 lasers that will pretty much do a lot of stuff and with minimal downtime too. And that's also the key in this industry as well, because a lot of people don't want to be out for a couple of days. Well, more than a couple of days. If you're out for a couple of weeks, it's just like, whoa, you really had to have something to really show for that. But so right now it's just me. And as I say, I have somebody else. I will start training once I open. And that way she can work under me and I can make sure that she gets all of the, just knows all the guidelines and protocols.
And the reason I ask that is because, especially in like South Florida market or LA or any type of market, there's so many guidelines to who can work under who. And you being an MD, I'm sure that gives you a lot more freedom because you can have providers working under you. You don't have to hire a medical director to kind of run your spa. So I really wanted to kind of go into that angle, definitely talk about that. But I also wanted to talk about kind of your niche. So being so niche with the lasers, kind of what passion that concept for you?
Well, again, when I started learning lasers
Yeah.
years ago, there weren't a
Yeah.
lot of lasers that really took care of darker skin. So
Mm,
usually it was no less than 3 on the Fitzpatrick scale. And so, because if you got to 4, 5, or 6, then everybody's like, "Ugh, we don't know what we want to do, if we're going to burn you or hurt you or whatever." And so getting a chance to do research on these lasers that I have and, partner with Alma Lasers, that's who I'm with. I got a chance to see that there are several lasers, and especially the technology has really improved now, that will take care of all of our skin tones. And that's one of the things that I really wanted to do, because a lot of folks want to do it, but it's also painful, or, it's expensive, or it's just like, oh gosh, I don't want to go through all that pain. Or of course, that's that fear of, I don't want to get burned, or I don't want to have a scar for life, because I'm trying to make myself prettier. So
yeah.
it's one of the reasons why I wanted to get into this. I do injectables as well, but at the same time, a lot of people do injectables, but not as many people do the laser stuff.
Why do you think that is? Why do you think it's so long that the laser companies finally, well, some of them getting to like the point where they're pinpointing like darker skin?
Why do I think it took so long? Well, again, years ago, there was more people who were fair skinned who were doing, and also Caucasian who were doing more of the aesthetic stuff. But at the same time, some people were doing it on a hush hush because nobody really wanted to talk about it. It wasn't until even in the past, I would say 5 to 10 years, you have more people of color saying, "Oh, I got Botox. Oh, I got lip filler. Oh, I got this." And now you're seeing more people of color doing it. And then it's like, okay, well, I'm going to say, well, hey, I got laser, or hey, I got this, and hey, I got that. I got this type of, procedure done, or, tummy tuck and things like that. So now it's more of a mainstream thing for people to do. But at one point it was a hush hush. And so because it was also, kind of still new too. That's one of the reasons why it wasn't a lot of people of color who were really doing the laser stuff.
Yeah, and I mean that's such a good point. I mean, I've talked to providers and they say something like a lot of people, African American or Black, don't really like aesthetics or are not knowledgeable about the aesthetic industry, right? But once they become knowledgeable about it, it's like, wow, this exists. Like I can use it because I used to have this thing in like in our household, like Black don't crack. It was like our thing, so we didn't need that
Yeah,
stuff. But
yeah.
like me getting into this industry, I learned so much. Like, wow, it's so preventable. It helps so much. Um, Even things like skin cancer, like in
Mhm.
wearing different products. So yeah, no, I definitely can understand where you're coming from. For sure, for sure, for sure, for sure. Can you tell the audience where you're at right now, as far as location wise?
Sure. I'm in Chatsworth, California. It's about 15, 20 minutes north of Burbank. It's in the San Fernando Valley.
Nice. And can you tell us a little bit about the industry over there? How's the aesthetic industry there? What are the new or latest trends that you see really over there?
So right now in my area, it's not a lot of laser aesthetics. I mean, well, there are, but it's just so far away. Like you would have to drive down into Burbank or Hollywood or drive all the way out to Woodland Hills. And so where I'm at is actually like a niche point because I can have, like people who drop their kids off for school, they can basically swing by, get some laser treatments done if they want to do a laser facelift or they want to do like a dermabrasion that's is not as harsh as a CO2 dermabrasion, like a skin resurfacing, but it's still, you don't have that as much downtime. And so you can do that right after you've gotten your groceries or dropped off your kids or on your way home. So it's a lot quicker and it's also just a lot more convenient for a lot of people.
Super cool, super innovative too. I think that's interesting. So you can actually do a facelift. How much is that compared to, like, I would say actually going get a surgery? What's the result compared to each other?
So, of course, surgery is going to yield more maximal results. But for
Yeah.
people who don't want to go under the knife or at least want to brighten their skin and everything, I have a laser. It's actually this Harmony Pro over here. And this one can actually help stimulate your collagen and help reform your collagen. Basically, it goes underneath the dermis and it just helps reformat and just tighten up your skin, tighten up your collagen so you look a lot fresher and brighter. And if you do several different treatments, you can literally see the difference in, bags under your eyes, if you have, like a lot more wrinkles around your mouth, even sagging jowls, and even, having a double chin. So you can actually see a big reduction in those things after several treatments.
Wow, wow, that is amazing. That's great because I don't see many people down here in the South Florida market using those type of tools right now, but they sound like they yield a lot of different results. And you put a lot of effort into actually partnering or using these different lasers. So this is going to be something that's newer for the market. How do you see the market growing in your area for the next couple of years?
Oh, I definitely see it growing because it's one of those things where, just being honest, people want to be pretty. People want to look good. Because of the advent of COVID, the industry really boomed because of everybody's on Zoom like this, and they were like, "Wait, I'm looking at my eyes, or I'm looking at my skin, and it's like, oh my gosh, I look crazy on the camera." And so they would try to at least get something where they can have, minimal downtime and just looking for fresher when they show up for their Zoom calls or Zoom meetings and things like that. And so we're still going to have Zoom. That's going to still be a part of our lives now. But at the same time, people want to, show off their best when they are out. So people have, been doing exercise and losing weight. And so it's like, okay, I want to tighten some skin around my face, or I want to, just have a certain look, or I want to get rid of these sunspots on my chest or wherever. And now when they really come out into the world, it's like, okay, I look good.
Yes, yes. Yeah, no, I agree. You feel good, you look good. I mean, you look good, you feel good, it's a
Mhm.
combination. So for sure, for sure, for sure. Tell us a little bit, but I wanted to touch on body dysphoria. And I know it's a big thing because the more I get into these companies down here, I see patients that they have to turn away and things of that nature. And I wanted to talk to you about kind of your approach and how do you view those type of situations?
So the body dysmorphia and things like that, those are it's one of those things where it's unfortunately a psychological disease. It's one of those things where people don't see what they truly look like, so they want to do like just mega enhancements on their bodies to make themselves look in their mind visually appealing. And even then, they still want to do more surgery or more this or more that. So for me, the way you can really sort that out so you can kind of get those patients out of your clinic, because you don't really want somebody with that because they're always going to find fault in you. They're never going to be satisfied. and they want to do bigger, bigger, bigger. And then of course, if there's an adverse event for somebody who's trying to get bigger lips, or, you know, or more of this sucked away or whatever, um, of course it's going to be on you, because you should have known better not to, you know, incorporate with somebody. And there are people who will, you know, take care of those folks, but it's one of those things where having the initial consultation is the key. Really talking to the person and finding out, okay, now what is your standard of beauty? Like, what are you looking for? Are you looking to just do some gentle enhancements? Are you trying to go for, you know, different things? And so, because if somebody's like, if they already come to you and they already have some extreme features, you know, still listen to them, still hear them out. And then you just have to politely say, you know what, I think what I'm, you know, like, you know, what your needs are exceeds exceeds what I can really do for you. And I want you to have, you know, the expectations you deserve. I don't think I'm able to do, you know, what you're asking for. And there's somebody else out there who you can, who could do it. And even if you have a few people who, you know, you can at least send
Yeah.
them to, so they don't feel like they've been just kicked out into the street. You can say, well, why don't you try this company or this person or whatever? And, you know, and again, give them a heads up and say, hey, you know, here's somebody who has body dysmorphia. You know, like, see what you can do, especially because you want to find somebody who can handle that a little bit better too.
Yeah, no, I get you, and I can understand that. And referring out is what most people say, like referring out to someone else that maybe can do the procedure for you, but I don't want to put my medical license at risk for that. That, you know, I
Yeah.
feel like, you know, that you don't need, for sure, for sure, for sure. Now, Dr. Ford, do you use social media for your like for your business or your I would say your profession?
Yes. So yes, we do have social media. We have an Instagram page, and we are in the works of building our website as well. And so our Instagram page is at Vita Boost Wellness, VitaBoost Wellness. And we'll probably do some TikTok stuff, because I have some fun things I like to do. I like to dance and have fun too. And I have a personal, you know, Instagram as well that I use, and I've followed a lot of different people, you know, in regards to that.
Yeah, no, that's great. And I asked that because I did a research study, and TikTok is actually the number one app to use right now in the industry. So, you know, it's great that you even mentioned that, because everybody whoever's not using TikTok, you're missing out. TikTok, you're missing out on the audience right there. Have you seen like a result of social media, and you're just like being, I guess, being employed, or even because I know you've done aesthetics prior? Have you seen any result from using social media and gaining new business?
So, with using social media, I've actually had the chance to do some procedures on people who know influencers,
Oh, nice.
and so I did a hair removal, and that person posted it to their page, and they had a ton of people asking, "Where's she at? Who is she? I want to go." And so, and that helped, because when you have one person who posts it, then their personal audience sees it, and then the next personal audience may see it, somebody might repost. And then, of course, when people come in and they videotape things, or they're actually live streaming, because I have some colleagues who said that they had some people live stream their, different procedures. It all helps, because, you know, you have more people seeing your results and seeing how people are comfortable with your results and happy, and even happy with their experience, and even have a little sneak peek of how the experience is. It makes a big difference, and you'll have more people coming through.
Oh, that's a good tip. Yeah, people want to feel personable, especially with, like you said, the experience, knowing what they're gonna expect, and also even knowing you. Do you put more personal information about yourself out there, or feel like that helps?
Yeah, yeah, because I have some things in the works for my Instagram page, and so you can get a chance to learn about me, and experience, and actually see what the experience with me here with Vita Boost Wellness will be.
Nice, amazing. Who are some people that you would suggest for them, maybe to the audience to follow, or even the industry, that are very experienced, that would be great to look up or follow?
Um, Let's see. So one of my colleagues who also uses Alma lasers, her name is Dr. Pina Panchal, and I want to make sure that I get her actual clinic website down.
Yeah.
So I would have to look that up.
No, it's totally fine. And we'll drop all the information below. So
Yeah.
yeah. Okay, awesome. Yeah, so everybody go follow her. I think she'll be great, right? Is she more of a teacher, or is she more like, what's her specialty by chance?
She does injectables, and she also uses the laser, and she uses pretty much all Alma products. And
Nice.
even if you just follow Alma Lasers or just Alma Laser Aesthetics, you'll be able to see a lot of great things that the Alma lasers can do.
Nice, nice, amazing, amazing. Now, I always like to touch on education and teaching. Is
Mhm.
there, how big is continuous education to you, especially being a provider?
Oh, it's huge. So in order to keep myself, current with my licensure, I have to do continuing education. And so now that, we've had, pretty much the flux of COVID, go away, we're having more live teachings. And even then I was doing online teachings and, like live video webinars and things like that. But yeah, so it's huge to continue to learn about not only what's going on in the aesthetic world, but also continue to learn about what's going on in the medical world too, because especially learning about different skin diseases. Because there are times, even as a family medicine doctor, I found skin cancer on some patients and they didn't even know they had it.
Wow, wow.
Yeah.
That's super interesting.
So,
I mean, yeah, that makes a lot of sense. Like, you got to be in the known of what's going on. You can't be so out of, the basics that you forget, especially being in this industry. So I can definitely understand that. Is there any conferences or trainings that you would suggest for providers?
for in what aspect? And for aesthetics
Yeah,
or?
for aesthetics, yes.
So there's the AmSpa clinic, AmSpa conference that happens once a year, usually in like February, like early February or late January. And that's one great place to kind of start to see what you want to do. And you get a chance to network with a lot of great people. That's actually how I met you.
Yes.
and, and and you just never know. I mean, just getting a chance to meet people, learn about the industry, learn about all the different things that are going on in the industry. And you go to the, where they have all the displays and just talk to people and learn about, okay, well now, how can you help your patients afford things? Well, there's care credit, there's, a few other things that are out there that can help patients afford things. How do you, even do your documentation online? I mean, they have a lot of different companies that will help do that. It's just a lot of great information that you'll learn and see. And I would definitely say that's a start. And if there is a laser that you're interested in, contact them, contact their rep because because with Alma Lasers, they have a conference that I'm going to attend in May coming up soon, and that's in Dallas, Texas. And so that's a great conference to attend where one, I can meet people who are across the US who are using the lasers and I can talk to them, network with them about, how they do marketing, how they do different things, any nouveau procedures that they can teach me because I know the basics, but of course, as time goes on, I'll get a chance to do better and better and better. And that's the goal for everybody. It's always to keep learning, keep growing because you want to continue to elevate yourself.
I couldn't agree more. Yeah, no, exactly. Like, really being, really practicing, on a daily, and knowing different people, knowing different techniques, and someone you can call is really
Mhm.
important. I totally agree. How big is community and actually knowing different people in your industry? Let's talk about that a little bit more.
Um, the community is as big as you want to make it. I mean, to
Yeah,
be honest, I mean,
yeah,
if you want to just have your core one or two people that you want to always lean on, and vice versa, they can lean on you. That's perfect. And then as you continue to go to conferences and have more discernment of which conference will work for you, which procedures will work for you, that's how you continue to grow. Because I've networked with several people here in California at that AmSpa conference, people in Nevada. people even in Virginia and Washington, D.C., and of course in Florida. And so, getting a chance to network, because the world actually is small, and, especially with with internet and with just with everything, all of your social media, the world is really small. So it's great that, we can be on two different coasts chatting.
Yes, exactly, exactly. I couldn't agree more. Speaking of the world, I know you're a world traveler. Where are your favorite places to go? Tell us about that.
Favorite places for me to go. I love Costa Rica. Costa Rica, pura vida. That's, they say just, basically it's just happy life. It's such a relaxing place. Everybody's just so pleasant, and it's just absolutely beautiful sunsets that you can watch every single night. It's like just watching a whole new canvas every night, or every evening, should I say. And another favorite place to go is Jamaica. Again, a lot of great people, a lot of great food. I love jerk chicken. I love spicy food. So,
Yeah.
getting a chance to go there. And let's see, where else? A fun, unique place that I didn't expect to really like was actually going to Finland. Yeah,
Wow.
I got a chance to go to Finland, to the Arctic Circle, to see the Northern Lights. So
Wow.
that
Wow.
it was crazy, but it was fun. I mean, it was cold. Of course, everything was negative something degrees, but it was a lot of fun getting a chance to dog sled and snowmobile and just meet unique people, learn about the Inuit tribes that are out there, that were out there at one point, and just, and just see the Northern Lights, and just be around so much snow and cold, but it was so peaceful and quiet, just
Mhm.
enjoying the silence.
Nice, nice. I'm gonna have to definitely go to all of those. I've been to a couple of those, but there's some of them I definitely want to go to, especially Finland. That sounds amazing. Northern Lights. I have to do that for sure, for sure, for sure, for sure,
Yeah,
for sure.
definitely.
So now I wanted to take this time to really show us your lasers in the background in each of them. I want you to tell us as much as you can about your clinic, so the audience can definitely get a good perspective of it.
Okay. All right. So let's see, let me take you on a mini tour of my laser.
Awesome.
All right. So I'm going to flip the screen around. So this right here is my soprano laser. And this laser is solely for doing hair removal. So I can do hair removal in any type of format. I mean, if you want your bikini line taken care of, even ear hair, nose hair, um, you know, hair on your knuckles and toes,
Wow.
I can do pretty much hair removal. And the great thing about it is that is for all skin types. And even if you've had a tan too, because there are a lot of lasers that really don't like, that you don't want to really use with tan skin, because it changes the, just how the color is picked up with the lasers. And so, but we can do this even with tan skin. And again, proven safety record. The great thing about it is that you'll see the just how quickly the hair follicles shrink up, and you'll see that it's less hair that grows every time you do a treatment.
Wow.
The next one is a newer, it's a fractional plasma. And so with this, you can actually do a lot more treatments, like more fine treatments. For example, fine lines around the lips, especially wrinkles and things like that. And this can even be, this right here is after 2 treatments. You can see how her wrinkles are pretty much, dissipated. And you do about a set of 3 or 4, depending on the person, and she can pretty much get herself looking almost back, like she lost 10 years of, like she's 10 years younger. And this
Wow.
is
So that's
another
kind of
one.
like the facelift almost.
Yes, it's like the facelift. So so fractional plasma, and this is this baby right here.
Mm.
It's a unique laser because, and I'll flip around so I can talk about this one. So it's a unique laser because what it is basically electricity. Think about the little plasma balls that we saw as kids, and you could put your hand on and see the little lightning under your fingers and things like that. It's basically like that. It is really concentrated. And so what it does is it will basically abrade the skin with little micro, kind of like microelectric shocks. But then it also helps rejuvenate your collagen, tighten the skin. And I can even show some pictures of before and after of some of one of my colleagues that I did a laser facial, excuse me, not laser, but a plasma facial on. And within 3 days, you can see how the blemishes are pretty much fading away. And even her skin tone is a lot more even.
Yes, yes. We'll put that up after right here.
Yeah. And the great thing about that, this particular machine is the fact that it can again be used on all skin complexions. So, and so I can, with
Amazing.
this one, yeah, I can take care of stretch marks. And a lot of women don't like their stretch marks, and some men too, if they've had, different life changes. But it can actually help fade your stretch marks as well too.
Nice, nice, nice. And you have one more, right?
Yes, and this is the Alma Harmony. So this one is pretty much the all-in-one. It can take care of melasma, red spots, brown spots, spider veins, and this is another one that can also do a facelift too. And so what I can kind of do is like I call it like a triple threat in a way, and it's a good way, because what I can do is literally do like a skin rejuvenation or skin resurfacing with the plasma. Then after that heals, do the facelift with the Harmony, and then again help with the Harmony clear any blemishes and things like that too.
Wow, wow. And
Yeah,
it's so interesting because your whole practice is based on lasers. It's like a niche that I don't see often. So I think it's going to be great, because you know
yeah.
exactly what you're doing when it comes to that specific technology.
Thank you.
Yes, 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 yes. So I thank you so much for sitting down with us and speaking to us about the aesthetic industry, your passion of lasers and your new spa. Tell everybody where they can find you, where they can come, what times you're open, and what you got planned next.
So we're still in the works with a few things, but I'll definitely have all of that posted after that. But we're in Chatsworth, California right now, and we're opening soon. As I say, like it's a lot of things are still in the works. That's why I was talking about all the different codes and stuff and making sure everything is on track. But I'll definitely let you know when we open.
For sure, for sure, for sure. So until next time, thank you so much for joining me. And until next time, bye.
Bye-bye. Thank you.